I want to show you today a medical device that changes lives. I've said this before, but about 19 million Americans suffer with fecal incontinence in the United States. What does that mean? It means losing bowel movements without wanting to. It also means feeling an urgency to go to the bathroom. So you get that sensation and you know that if you don't run, you're going to have an accident. Another definition is when you wipe and you wipe and you wipe and you feel like you can't get clean or you haven't fully evacuated after having a bowel movement. These are all different versions of fecal incontinence. Now, conservative measures include taking fiber supplements to try to bulk up the stool and pelvic floor physical therapy to strengthen the pelvic floor to help give you more control. For a good number of people, that's all you need, but there are a percentage of people that the conservative measures don't help. The good news is there are advanced measures that we can use to help get control. Now, before I show you the device, I just want to let you know that this device can be used to help the same person with both fecal and urinary incontinence. So in somebody that has both, what they call dual incontinence, this one device will work for both of those issues. Now, just so you know, this thing is an implant. So that means it goes inside of your body, under your skin, and it stays there. It kind of looks like a pacemaker, and it essentially is a pacemaker for the bowel and bladder. Now, the procedure is called sacral neuromodulation, and it happens in 2 stages. The first stage is where we place the test lead called PNE. Okay, using 2 hands here. So the first stage is called PNE, and that's where you put this tiny wire. I don't know if you can see it. Bad influencer here. But it's this tiny wire that goes into the S3 foramen. So essentially, it's an opening in the sacral bone, the sitting bone, and it sits right next to that nerve that helps control bowel and bladder. As you can see, it's incredibly flimsy. It can't really poke you, and it is not uncomfortable for patients. This is inserted in the operating room under anesthesia, meaning that the patient is usually just given some moderate sedation. You're laying face down. We use an X-ray to make sure that we get this little tiny wire in the right place. We're able to know that this is in the right place because when we stimulate that lead, we see bellows in the perineum, and we also see the large toe kind of flicker a little bit. Once this wire is confirmed in place, it is attached to an external battery, which is not very large, probably less than the size of a credit card, and it is taped to the patient's back externally. Now, this is where the patient is programmed specifically by the representative of the company that makes the device. And over the next 4 to 7 days, the patient keeps a diary to let us know how their symptoms are. Are they having fewer accidents? Are they having no accidents? Are they having the same amount of accidents? Is there pain? Is there discomfort? They keep a diary of how their life changes. After that 4 to 7 days, they come back to my office. We remove that tiny little lead. It's less than like taking out an IV catheter, and we discuss how the symptoms have changed. If there is a 50% or more improvement of symptoms, we go to stage 2. Okay, now the second step, you go to the operating room, same exact thing. You're put to sleep, given some sedation, some numbing medicine. We put a little bit bigger of a wire inside of there. Again, we test it to make sure we get bellows, we get the toe flick. We look at the X-ray, we make sure it's in perfect position. Then we attach it to a battery that's going to be internalized right under the skin, the same way that somebody has when they have a pacemaker. However, instead of it being in your chest, it's placed just above your glutes. Now, for the device that I like to use, they actually have 2 different versions of the battery. There's this one, which is the rechargeable battery. This is about 1.5 inches this way by 2 inches this way. And then this one is very similar to a pacemaker. It's about 2 inches by 2.5 inches this way. These batteries get hooked up to that thicker wire that's in there. It gets tunneled under the skin, and everything is placed internally. You have absorbable sutures and you have skin glue on top, so there are no stitches that need to be taken out or anything. Again, we test it to make sure that it's in the right place, that you're getting the good reaction that we want. And then you're all done. Nothing else really needs to be done surgically. And there are several programs that the company will help teach you how to change so that you get the best results. People will often ask, can I go to the airport? Can I get MRIs? Yes, you can go to the airport. It's not going to trigger anything. You can go get an MRI. They're all MRI compatible and safe. You can swim, you can bathe, you can scuba dive, you can exercise, you can do all the things that you probably weren't doing because you were suffering from incontinence. This is one of my favorite procedures to do because essentially it's 10 days to 2 weeks from having full-blown accidents to having control with these two outpatient procedures that are minimally invasive. Now, if you're in the Houston area and you suffer with fecal incontinence, smearing, wiping and wiping and wiping, fecal urgency, please come see me. There are ways that we can help you if pelvic floor physical therapy or medications haven't worked. And you can be back on the road in 2 weeks.